In medicine and money today, 60 is the new 40, as they say. And as Americans live longer and fight to stay fit, spending on planned surgeries for knee and hip replacements has increased an estimated 44% to $25 billion since 2010. Joining us now is top orthopedic surgeon Dr. Berger. Great to have you on our show.
Well, Angie, thank you so much for having me.
You invented a technique that is transforming the industry. Tell us about your innovation.
Well, I invented minimally invasive hip and knee replacements. That is, doing it without cutting the muscles, ligaments, and tendons, so there's a quicker recovery. In fact, almost 20 years ago now, I started doing outpatient hip and knee replacement, the first in the world to do so, and I've done now 10,000 outpatient hip and knee replacements. So patients recover simply quicker. They're out of the hospital in a few hours, they're back to driving, back to their desk jobs in a week, and back to playing golf and normal activities in 2 to 4 weeks. So very, very quick.
What demographic are you seeing the most?
You know, it's really all comers. I've operated on patients as young as teenagers and as old as over 100. The average age of the patient I'm operating on now is about 52 years old, so younger than you'd probably think.
What do your patients say? How critical is it to shave down that recovery time for business owners or CEOs?
Well, this is very, very important. You know, people can't take a lot of time off work, and I now have CEOs and other people in business that don't even tell anyone that they're getting their surgery done. They take a week vacation, get a hip or knee replacement, come back, and instead of going to Disney World, they've got a new hip or a new knee.
What are your projections for growth in your sector?
You know, as our population is getting more active and also aging, and people don't want to stop what they're doing, we're seeing a big growth in hip and knee replacement. And these are just getting more and more common as time goes on.
How competitive is your industry?
You know, right now we're doing hip and knee replacements as an outpatient. We're innovating, trying to do more research in hip and knee replacement. We have a great lab that has developed new technologies to do hip and knee replacements, so that's really putting us on the cutting edge.
You're a top surgeon, so what are your tips for selecting a great surgeon?
I think when you look for a doctor, you want to find someone who's been recommended by friends, family members, people who've already had the surgery done by them, so you know you're getting someone who's good. Also look for someone that this is what they specialize in. They don't do everything, they just do outpatient, minimally invasive hip and knee replacement. Don't wait. Just about everyone I operate on comes back in a week or two and says, why did I wait so long? People endure the pain and the confinement of arthritis because they're afraid of having surgery. With this new minimally invasive surgery, there's very little pain, very little downtime, and they should just do the surgery and do it now.
What would be some red flags to look out for when selecting a surgeon?
I think going to someone who's just starting to do this or just starting to do any new technique is probably not a good idea. You want to go to someone who has a lot of experience doing what you're going to get done. I think that's the best tip.
Thank you so much, Doctor. We wish you the best of success.
Angie, thanks so much for having me. I appreciate it.
Check out businessfirstam.com to find out where to see our entire show. And don't forget to like, follow, and share Business First AM.